Hi everyone, welcome to Making Medicare Fun. I'm Ricky Stewart, a licensed independent agent serving my clients in Florida, Alabama, Mississippi, and Louisiana. I'm in Pensacola, Florida right now, bringing you our fall episode of Making Medicare Fun. This podcast is for my clients and for their friends to help them know what to do, what to ask, and what to know now that they're on Medicare. So on this special episode, we are heading into the annual enrollment season, which is October 15th through December 7th of this year. We're going to focus on the changes to Medicare for 2025 and how they will hopefully help you in the long run next year. So be sure to stick with us all the way through this video as we'll unpack some of the important changes to Medicare just around the corner. So let's begin and start this podcast by educating you on where all the changes for 2025 first took place. Back in 2022, the Inflation Reduction Act passed, bringing several updates to Medicare that will take effect next year. These changes apply to all standalone Medicare prescription drug plans and Medicare Advantage plans with prescription drug coverage. So what does this mean for you if you're on Medicare? I broke this down into 3 points. So 1, the removal of the coverage gap, also known as the donut hole. 2, a lower max out-of-pocket for Part D prescription drugs. And 3, last but not least, a new prescription payment plan option. Let's dive into each one of these. And I'm going to try to make this as simple as possible so you'll be able to share what you know with your friends and family. 1, removal of the coverage gap, also referred to as the donut hole. Some, I know, are going to be very happy about this going away. Bye-bye donut hole. You won't hear anything about the donut hole in 2025 because there won't be one. Next year, the coverage gap or donut hole will be removed, and this is good news for many of you. And there's more to this, so listen up all the way through. Now, Medicare Part D prescription drug coverage will have 3 stages. There's the annual deductible stage. If your plan has a prescription drug deductible, you will be responsible for paying the full cost of your medications until you reach this deductible. Then there's the initial coverage stage. After you meet the deductible, you move into the initial coverage stage where you'll pay either co-pays or co-insurance. And lastly, the catastrophic coverage stage. Some of you already know about this one. Once you or others on your behalf have paid a total of $2,000 for Medicare covered medications, including amounts paid toward the deductible, you'll move directly into the catastrophic coverage stage. At this point, you won't have to pay anything out of pocket for Medicare covered Part D drugs for the rest of the year. So this should be good news for people with lots of very expensive medications. Let me break this down more. Once you pay $2,000 for your prescriptions, you will pay $0 for Medicare covered Part D drugs for the remainder of the plan year. Now this rolls smoothly into our second point to know about the Medicare changes for 2025 on the out-of-pocket maximum reduction. This just continues on with what we're already talking about, which is in 2025, your out-of-pocket max is being lowered significantly. This year, for all Medicare members, no matter what insurance provider you're enrolled with, the Part D out-of-pocket max was $8,000. Now, for the next year, 2025, once you've spent $2,000 either on your own or with help from others, you won't pay any co-payments or co-insurance for your Medicare Part D prescription drugs for the remainder of the plan year. I want you to know that while these changes aim to reduce prescription drug expenses overall, you may see higher deductibles or premiums in 2025. So make sure to read over your annual notice of changes. We call it ANOC in the insurance world, which you should already have gotten in the mail or email, whichever way you opted to receive your information from your insurance company when you first enrolled in your current plan. So just to finish this explanation up on the new catastrophic coverage stage in Medicare for next year, remember, while you may end up paying more earlier in the year during the deductible stage, you may see overall savings with the lower out-of-pocket maximum. Lastly, listen up. the Medicare prescription payment plan option. This may be something you want to do, may be something that you do not need to do. So listen in here. This is number 3. This annual enrollment, you'll want to know that there's a new program called the Medicare Prescription Payment Plan. This program is optional and offers a way to spread out your out-of-pocket prescription drug costs throughout the year rather than paying the full amount when you pick up your medications. Using this option, you'll receive monthly bills that break down these payments over time. It's important to understand that this program does not reduce your prescription drug costs. It only allows you to spread them out. This information I'm bringing you is according to an article released by United Healthcare in September called Unpacking the Changes to Medicare in 2025. And of course, their information from Medicare.gov. Medicare.gov also does a great job explaining these changes that I'm bringing you today. But here specifically, as we're talking about the Medicare Prescription Payment Plan for Medicare.gov, they wrote on their website that, quote, all plans offer this payment plan option and participation is voluntary. They further explain if you select this payment option, the Medicare Prescription Payment Plan, each month you'll continue to pay your plan premium if you have one, and you'll get a bill from your health or drug plan to pay for your prescription drugs instead of paying the pharmacy. The article also states that there is, quote, no cost to participate in the Medicare Prescription Payment Plan, and I'd highly recommend checking this out if you think you'll need it for 2025. I have included a link in the description of this podcast for more information on where to go. And depending on your carrier, you may need a different link. So be sure to contact your customer support line if you have any questions. And that brings up another important point, because as my client, you know that I'm here for you, but it's important to go with a great company that has wonderful customer support that you can call and ask questions to. I'm always an advocate for a local agent, so going with a local agent enrolled with a great carrier obviously helps you out throughout the year. So someone who's going to have your back and know these important changes that I'm bringing you today. I'd love to be your agent, but I'm always a fan of the local agent, someone who cares about you. Use your local agent. Most of them want to help you, and you may have some important questions like this new payment option, for example. Go with someone who knows about the changes in Medicare. Thank you so much for listening to the fall episode of Making Medicare Fun, where we've talked about some of these 2025 Medicare changes. And I want you to know that if you're my client and you're still confused, I'm happy to help you. You can call or text me. But these are designed, these changes, to hopefully help lower your overall prescription drug cost and provide more flexibility when paying for your medication. So if you're one of my clients and you still have questions, feel free to just reach out to me directly. You have my cell. And I will put a link in the bottom of this episode that will have my direct contact information. I do want to tell you a little bit about me as a licensed independent agent serving my clients. My family has worked in Medicare for 20 years now. This year we're celebrating 20 years. My mom started selling Medicare plans 20 years ago this year. And a few years after her, my dad joined her in helping people transition into Medicare, and now me. We love the local agent because we know how to help you, and we've seen the difference it makes when you go with someone that you can reach out to with your questions throughout the year. We also have family members on these plans, and we know how they work personally and, yes, professionally. If you want more information on how I can help you, visit my website. It's simply insuredbyricky, RICKI.com, or just, again, go to the link in the description of the podcast, where you can quickly save my information to your smartphone. I look forward to working with you this fall and for years to come. Thanks again for listening and watching this episode if you watched the video. And I do hope that this annual enrollment is fun for you if you're on Medicare. If this has helped you in any way, please share it with your family and friends. Thanks again.